Coming up on 8:30, and of course that means Talk to the Doc. Dr. Tim McKnight in studio on a snowy morning. It was great. You walked in the door, you had a nice snowy backdrop to you.
I don't know if that was great. I feel like it's February. What happened?
It was almost like out of a movie, though. It was like, here he comes through the snow flurries. But we all love that first snow. And then about 3 weeks from now, everybody's going to be saying, when's spring going to get here?
That's what I'm worried about. How many more months of this we're going to have to put up with?
Right.
But, we chose to live here, so we got to accept it.
This is true. And we're moving along. If winter's anything like how quickly Fit for Life has gone, it's going to be here and gone in no time. Week 10?
Week 10, yep.
Wow. This is so 2 more weeks left after
Two
tonight.
more weeks, yes. And then we'll have a short break, and then we start right after the first of the year.
So we want to mention again, if anybody has the desire to join the next Fit for Life class, it'll be starting in January, and it's filling up. So don't delay, because really you cap it off usually around 50 or so.
Right. And, this time we're moving this class up to community hospice on Commercial Avenue in New Philadelphia.
So you're taking the show on the road,
We're going on the road, yeah.
Okay.
So there's probably some listeners up in the Dover, New Philly area that this might appeal to. We have a lot of the employees at community or hospice are going to be taking the class, but we have
great.
open spots for other people who are interested.
What a great idea. And I mean, this may be turning into the wave of the future, that the class is out at different groups like this. What a perfect idea if you have a big company or a lot of people that want to take this at once. It would be perfect.
It's really exciting for us to have those kind of numbers, because that tells us there's a lot of interest, and we'd love to share the message.
And this is tonight's topic is pretty timely. Shoveling snow.
Yeah,
things like that.
Yeah,
you're going to have some back issues, and so that's part of the topic tonight.
That's right. When I developed the course probably 15, 16 years ago, it really started with what are the topics that I'm having conversations with about patients in the hospital, and back pain was such a recurring topic that we had to find a way to talk about back pain. So we'll start off with the first half of the lecture. We'll talk about strength conditioning, musculoskeletal health, and then we'll move into back pain, both preventing back pain and managing back pain more effectively. And I've had back pain for years, and once I understood what caused it, it really empowered me to be able to keep it under control and at a minimum.
Yeah, and
that's critical.
Some people get, they're out trying to get stronger and help themselves, and they actually hurt their back.
They make it worse. Exactly.
You've got to make sure that the back is something that is very critical, and you use it every day, and you don't want to have that constant pain. And that's not a life you want to live.
Yeah, and that's really what Fit for Life is all about. What's the root cause? If you understand the root cause, then you're really able to start addressing that and correcting and reversing these conditions, and back pain is no different.
What's the biggest cause that you find with back pain? Is it?
You're going to find this funny, but it's sitting.
Really?
Prolonged sitting.
Wow.
It weakens the gluteal muscles, weakens the abdominal muscles, it tightens the hip flexors. And then when you start standing, the back gets overworked. It tilts the pelvis forward because of the muscle tension and the weakness in the core muscles. And so sometimes the best thing you can do is strengthen the gluteal muscles, stretch the hamstring, stretch the hip flexors. But most people don't even know what hip flexors are. And that's the problem that I personally have. And I woke up today with the hip flexor sore, and I know it's time to stretch. And what I found is best for me is walking lunges. Makes a huge difference.
Huh.
So it's just basic anatomy and understanding what caused it and how to correct it. And if I had not done this 15 years ago, I'm sure I would have had back injections at this point.
Right.
But I'm not even close to considering that now.
Just try, and again, what a perfect fit with 2 weeks ago. These programs for Fit for Life all tie together. We had Coach Hartzell talking about the stretching and the bands and so forth.
Yeah.
Just getting those muscles loosened up is the key. And if you do that on a daily basis, first thing when you get up in the morning, bend and stretch and get everything warmed up.
But you have to know how to do that, right?
That's true,
because when you say stretch, the first thing people do is put their arms up over their head and maybe try to touch their toes. But there's so many other muscles that we don't even touch when we go through our normal stretch routines that We have to learn how to do them.
So you're saying that when I get up in the morning, that lifting the grand piano has not been the correct procedure for me, probably to loosen the back up.
Well, if you start with a leg press with a grand piano and end with an overhead press, you're probably on the right track.
Okay. Yeah, I wonder where that pain was coming from, but it could be the reason.
You're going to have to get a baby grand. That's all I can tell you.
That it's all falling together at this point. So, no, in all seriousness, though, it is something that people struggle with, I mean, all the time. Chiropractors, orthopedic people, I mean, they're medical family doctors. When you have back issues, it can be very, very difficult. I know because my wife is struggling with some, and it's really tough. Like you point out in her situation, her posture.
Yes,
you got to get her standing up straight, and when that back doesn't feel right, you find yourself slouching a bit or bending over, and that's not normal. That's not the way it should be.
Right. The hip flexors, when they're tight because we sit, they pull us forward, and we know we should stand up straight. So to overcome that, we have to use our back muscles, and they just get tired of holding ourselves up. So if you don't fix the hip flexors and just strengthen the stomach muscles and strengthen the gluteal muscles, you're never going to be able to manage it effectively.
And by this point in Fit for Life, week 10, it, like I say, it all starts to fall together. You start to understand how the body's working and what you need to do to make it feel better. And this is just a natural progression as we get set to wind down the program over the next few weeks.
Yeah, and next week we'll talk about disease prevention, and then we'll spend half the lecture talking about hormone replacement therapy, which is one of my favorite topics because that can really make a difference when you're talking about trying to feel like you're 20 years younger. And we can do that safely and effectively.
All right. Fit for Life. Again, we can't say it enough that the January program will be here, and you've already got a big group to start this, so not a whole lot of spots left. If you truly want to get in for the first of the 2020 session, get a hold of Trinity Hospital or Dr. McKnight's office.
Right. And, if you can't get in for some reason this time, we'll put you on the wait list and call you in the fall. But there is room for your listeners. They just need to call soon and get registered.
Sounds fantastic. Dr. Tim McKnight from Trinity Hospital, Twin City, our Talk to the Doc segment on Tuesday mornings. Always good catching up.
Thanks. Good to be here.
And thanks for bringing the snow with you today.
I'll try to do better next week.
Sunny and 75 would be my pick.
Okay.
If we can do that. All right. Dr. Tim McKnight, Talk to the Doc. Every Tuesday morning we do it for you here on Big Hits WBTC.